I know we're all super passionate about it. So, thank you so much for joining our talk. Our talk is on how to become an effective and efficient health policy advocate. My name is Dr. Cortlyn Brown. I'm Vice Chair for DEI at Carolinas, as well as one of our clerkship directors for our Healthcare Disparities and Emergency Medicine rotation. And in my current role, as well as past roles, I was SNMA National Vice President. I did a lot of advocacy and a lot of more of the strategies that we'll talk about later.
And I'm Valerie Pierre. I'm a clinical instructor and clinical ultrasound fellow at NYU. Shout out to my program director and vice chair of education in the back. Thank you for coming. So I know Cortlyn through our involvement with SNMA. I was the co-chair for the Health Policy Committee for 2 years. So we organize our National Leadership Advocacy Conference every 2 years or every year on Capitol Hill. And we got to lobby and do a lot of great activities that we're going to discuss today. Okay?
Perfect. So we have no disclosures. I would love disclosures, but we don't have any right now.
So we're going to talk a little bit about advocacy. So a lot of people think that advocacy equates to politics. It does not always do that, right? So yes, it can be lobbying on Capitol Hill. It can be testifying before a committee. But it can also be you joining a social media Twitter campaign and tweeting out things to people that you want them to know about whatever's happening in the universe. Or could you like actually join a real social media Twitter campaign and just advocating for a certain subject that's already like tweeting your representatives about an issue or anything like that. It can also be you joining your local hospital committee and speaking up on behalf of your patients, your colleagues, or anyone else, right? So advocacy comes in many different flavors. It depends on what's important to you and who you're advocating for. So we had you guys sit at tables with different stickies, right? So one is going to be who, one is going to be what, and one is going to be why. And that's something Cortlyn and I came up with for this activity, right? So I want you guys throughout this presentation, if you are sitting at a table with who, to put like, who do you advocate for on a daily basis? Is it yourself? Is it your patients? Is it your colleagues, your neighborhood, your children, whoever? If you're sitting at a what table, we want you to say, like, what do you actually do to show that you're advocating? Do you present in a faculty meeting? Do you speak up at your local PTA meeting? Are you lobbying on Capitol Hill? Testifying before a committee, joining a social media campaign. So just put an example of something you did or would want to do. And why? It should be personal to you. So I know someone who was actually punched on shift, right? So they speak up for the workplace and violence committee. It could be, you know, why do you do it? You were homeless in your childhood, so you want to speak up for that. So whatever's personal to you, put on your why. We're going to do something with this a little bit later, okay?
And make sure that just on your sticky that you just write one example of each, and we'll talk about that a little bit later.
Okay, so as I said, Cortlyn and I, we've done a lot of advocacy work on a national and local level and state level as well. And so we came up with something that kind of encompasses what we've noticed, right? The 3 Ws of advocacy: the who, the what, and the why. We're going to get into that. So the who, right? So a lot of times we inherently advocate for ourselves and we don't even know it, right? You are at the gas station and they overcharged you. You're going to speak up about that, right? No one wants to pay more. Surprise billing is a big issue right now for our patients, and that's something that SAEM, EMRA, AAEM, ACEP has been really big on the forefront, talking to legislators, trying to get that taken care of for our patients. We don't want a patient who just came in and maybe it was just a simple lac repair, right? Their bill might be $3,000. That patient doesn't have insurance. They never get to pay the bill, and they're going to keep coming back and back to the ER, and their bill is getting higher. They could get a lot of, bad effects from that, right? They might have trouble getting insurance in the future, or the hospital send them letters to their mail and then they can't get a job or whatever. So these are things that we talk about a lot. So who are we advocating for? Obviously yourself. We inherently as EM physicians are always advocating for our patients, right? When we're speaking to consultants, we're asking them, hey, we want this to be done for this patient, or we need you to see this patient, or do an intervention. We're always doing that on shift, right? Also, it could be for your hospital committees, right? So if you are passionate about workplace violence, you might join that committee about that. Or if you're seeing patients who have opioid abuse in your ED or in your shop a lot, you might want to advocate for those patients. So just think about, who do you advocate for on a daily basis, or who do you want to advocate for?
So the next we'll get into a little bit about the why, and I like to walk around while I do presentations, so just bear with me, guys. So for the why, there's 2 main advocacy or lobbying strategies. The first one that we'll talk about is inside, and that can be taught about as gaining access. So there's various inside strategies. So you can send an email to your policymaker, you can send snail mail coalition building, and the point here is much more indirect, and it's to put a lot of pressure on your legislator or your policymaker to make those changes. And we'll go into these in a little bit. So first we're going to talk about some written insight strategies. So a lot of people always ask, should I send snail mail or should I send an email to my legislator? There's some data that shows that a written snail mail is actually much better received and has much more influence over what that policymaker later votes. But it's really important to think about what that letter has to go through when it arrives wherever you're sending it. And it actually has to go through about 3 weeks of screening. So if you have something that's time sensitive, an email is going to be the best way to send it. So what actually happens again? So what are those 3 weeks of screening? So usually about 2 weeks of actual security screening, and then the legislative correspondent will get it and they'll verify that you're a constituent. So that's going to be a big theme. Basically, your legislator needs to know that you're a constituent. Then the letter will either get sent to the legislative assistant or the legislator, and they'll read through it. The legislative assistant, if they're the ones that are reading through it, they'll actually create a summary and a tally, and they'll combine that with similar letters so that they will then be able to present that to the legislator before they vote on anything. And so, similar to how whenever we're reading a patient's chart, it would be really weird if somebody wrote the MDM before the review systems. Like, that would just throw you off. You'd be like, oh, they're such a noob. Like, they don't know what they're talking about. So our legislators, as well as legislative assistants, like a similar format. So the first thing that you'll do, introduce yourself. And you should put your address, the address of your hospital, wherever you're writing from. Again, this goes to show that you're a constituent. The next is addressing your legislator or your policymaker. And so you actually address them by saying the honorable, which is something that I didn't know. Then your first true paragraph. So this is reintroducing yourself. This is talking about why you're the best person to be talking about this, why you're passionate about it. So what is your background? Where are you from? Then you go into a little bit of the specifics of what the issue is, giving some evidence. Then this is really the most important part. So this is your emotional plea. So this is what legislators and policymakers really want to hear. So they want to hear that story about the 30-year-old mother who didn't have insurance and had a stillbirth. They want to hear those personal stories, and that's really what's going to move them. And then the last part is your ask. So you need to be really specific. So I want you to vote yes on certain bill number. Which brings us to the next thing. So how do you actually find how to contact your legislator? How do you find their address? How do you find what bills names are coming up? How do you find when bills are getting voted on? So we actually got a Google Doc here, and the QR code will take you there, and it has links for all of that information as well as some of the references that we'll give throughout the chat. So similar to written insight strategies, phone calls do follow the same format, and it's important to note that oftentimes you won't be speaking with the legislator or policymaker over the phone, but that doesn't matter because that legislative assistant that you're chatting with will create that summary similar to what they did for your written communication.
And just to reiterate with that, so a lot of times when you call, you might get a voicemail, right? So it's quite a few times I've called for different bills I wanted to support, and I got a voicemail, but if you call back the next day or next day, the voicemails obviously add up, right? And if you call enough, sometimes they'll actually call you back. They might invite you to wherever it's the state capitol or the actual Capitol Hill. I've been invited a couple times because I've done that, and they'll listen to you. Will they necessarily take everything you're saying to account? Not necessarily, but at least you can get on the legislative assistant's their schedule, and they will normally bring that back. They have to the legislator that they're representing. So if you leave a phone call, you get a voicemail, leave the voicemail. They do listen, and keep calling, and maybe get a group where if it's a Twitter campaign or whatever, they're going to get a lot of voicemails, and they'll have bigger groups come to discuss it with the legislative assistant. So also another tip for verbal inside strategies is testifying before committee. A lot of people don't get the opportunity to do this. This is really kind of hard to get invited to even do that, but if you do need to know when you need to go. So it's usually a very strict schedule. You can't be late. Normally you need to be very early, especially if it's on Capitol Hill. You have to go through security multiple times. They'll check you, everything like that. So know when to go and what does your day look like with check-in, okay? And then what you need to know is who sponsors or opposes the bill. So you might be surprised. There's a lot of physicians and obviously lawyers on Capitol Hill. You might think that they share your sentiments, but not true, right? There's a lot of lobbying groups that have a lot of interest. So you need to know who sponsors and opposes the bill. And then who are the committee members who are for that, and who are their chairs? And you need to know when you're talking, is the chair going to be there? Because if they're there, that's the person you want to address, okay? And what's the problem? You have to be very well-versed on whatever you're speaking up for or against. So as Cortlyn said, we gave you guys the QR code. We'll show it again. But you can easily find these bills online and find out who's supporting them, who's against them, and what's the overall issue that they're really trying to tackle. And then what do you want the legislators to do about it? So usually before I've ever done any of these visits or looked at bills, I know what my stance is and I know what I want someone else to do about it. Do I want you to vote for that, or do I want you to vote against it? And this is why. So I usually start with that first and then work backwards and do everything else, okay? So don't just kind of go in there like, I like this bill, or I don't like it, or I want this. You need to be very clear about what do you want and what do you want them to do about it. And a lot of times you only get 2 to 3 minutes for this, right? To be very, very concise about it. So do what you have to do, but just make sure you have a very concise argument of what do you want them to do about it, how do you want them to vote, is the chair going to be there, and what do you want to get done, and how can they help you do that, right? Or how can you help them do that?
So the next insight strategy that we'll talk about is lobby visits. So the first time that I thought about doing a lobby visit, I was super overwhelmed and really stressed out. And then I did a few of them, and I was like, oh, this is actually just having a conversation about what I'm passionate about. So it's really not a big deal, and anybody can do it at any time. So some things you need to know about. So you need to request your appointment. Again, the QR code will give you the information for all the legislators' contact information as well as their schedulers. It will also tell you when each bill is going up to vote, because you don't want to do a lobby visit for a bill that's not going up to vote for a year, because they're not going to remember that. Even though they make those tallies, that's going to get lost. So you want to make sure that your timing is appropriate. Then next is preparing. So who do you actually want with you? So this picture is actually my intern class whenever we went to lobby. But generally, you usually have either you go by yourself or you go with up to 4 people. So 1 to 4 people is kind of the standard. And it's usually people with similar backgrounds, maybe slightly different perspectives. So you could go with an emergency medicine physician, an EMPA, an EM nurse, and a social worker. And then, important to know, similar to what we were talking about before, you follow that same story in terms of, and same structure in terms of how you would do a written letter or a phone conversation. Other things to know, similar to what Valerie was mentioning, you need to know the legislator's stance. Was the issue voted upon in the past? Oftentimes these issues will be voted upon in subcomponents, and you'll need to know that. If so, what was the outcome? And what's the opposition, and why are they wrong? And then you should have one person that's a part of your group write down the names of any legislative assistant or legislator, anybody in the room that is not you that's there, because you'll need to write a thank you letter with your direct ask to all of those individuals. And that's kind of the standard policy. So next we'll talk about some outside strategies. So op-eds. So I have not written any op-eds, but to do this talk, I did some research on what you actually need to do. And similar to what we're talking about, there's a structure. So the first part is your lead. So that's your kind of hook where you catch them. So it can be a timely reference to a news article. It could be an anniversary, so an anniversary of a drug discovery. It could be a new study that just came out that you want to talk about. And oftentimes they're pretty funny. They can have pop culture references, really just grabbing that attention. Then the next is the HPI, so that's what your issue is. Next paragraph will be the MDM, so that's your solution. So you generally have 1 to 2 points, and each point will have evidence and conclusion. Then you should always have a to be sure paragraph, and this is really your paragraph where you preempt any potential critics and say why they're wrong, where you state any potential flaws in your argument. Then your conclusion, you'll circle back to your lead, and you'll give your specific call to action. And one thing that I was always confused about is, how do we actually know what journal, magazine, newspaper should I submit to, like Toledo Times? You know, where do you submit your op-ed to? And there's this great website called the Op-ed Project that actually lists almost every single publication, even local newsletters, and says what they're really passionate about. So you can use that to get a sense of where to submit your op-ed. And then we'll just talk about letters to the editor. So really the big thing and the difference between letters to the editor and op-eds are letters to the editor want to know why you're the best person to speak on this. So they want to know why you're the expert on this topic. Otherwise, everything relatively follows the same format.
So going back to the why, right? The who, what, and why of advocacy. So why are you doing this? It should be a key issue that aligns with your purpose, your passion, and your values. So for me, and kind of touching on what Cortlyn talked about earlier, I got involved in advocacy in undergrad and medical school because there were issues I was having in terms of, like, you know, wanting to make sure the communities I was working in, the patients were taken care of, that they had, you know, they had support from different local institutions and also from local governments, making sure they had the ability to go see, you know, primary care physicians without worrying about how are they going to get paid or things like that. So it kind of started there, and then I got more involved in, obviously, you know, we all know about the whole issue with residencies and matching and having a lot of people who are not getting positions. And so I kind of got involved in that more in the medical school and then in terms of residency. So it's very easy to, I shouldn't say easy, but it's not that hard to get involved, right? Just kind of, you guys are here already, you're part of SAEM. They have an advocacy day. ASEP and EMRA has an advocacy day. Almost every organization has an advocacy day. And that's how you can get started and meet people who are like-minded like you, who want to get engaged and want to speak up and don't necessarily know how to do it. Lobbying is, I think, one of the easiest ways. But op-eds, all of this stuff, you can easily get into that as well once you get the ball rolling. So things that I've advocated or lobbied for before has been homelessness. So homelessness is really big in a lot of major urban cities. It's getting even worse with the pandemic and all that we're seeing. So we're seeing a lot of issues related to homelessness and then substance abuse. We're seeing that all the time, every day. And then also surprise billing, as I talked about in the middle. So that's been on the agenda for at least 4 to 5 years now. There's like a big Washington Post article about it a couple of years ago. And so now even more lay people are talking about it because they're saying, you know, I was a victim of surprise billing. Can we work on that too? So these are just some of the major issues we're talking about, but I think it's easier if you guys first identify what's important to you, and that's how you're gonna wanna speak up. Because if you don't really care about it, why would you advocate for that, right?
Okay, so now we're gonna get to the activity. So I want everybody, if you haven't already written down on your sticky, one example for that that's pertinent to that one, I want you to do that. Take about 20 seconds. And then I want everybody to kind of walk up there. We put some examples up there. I want you to throw your sticky next to the category that's a part of. And what I want everybody to do is come up with an advocacy strategy. So you'll see we have different papers around the room here. And I want you to take one sticky from the who, one from the what, and one from the why up there that makes sense to you. And then bring it back and just put them on the paper, and then we'll share. So take about 20 seconds to write on your sticky, and then we'll give you 2 minutes to go up there, choose your who, what, and why. It can be your original sticky that you had, it doesn't have to be, but just creating your advocacy story, something that speaks to you.
And you know, this is more of a narrative, an example that we're doing activity. So if it doesn't exactly speak to you, that's okay. But maybe it's something that you might want to start thinking about, right? Like I said here, you know, you're going to advocate for yourself by presenting in a faculty meeting because you were a victim of workplace violence. So it doesn't have to be exactly, you know, correlating to your story, but just like create a narrative. This is just for fun. It's a quick activity.
Should have like music while we're doing this.
I know. Well, we're almost out of time.
So whenever you're up there, again, remember to choose one sticky from each category to create your own story.
You guys can share if there's maybe one thing that you guys resonate with. You guys can share that, no problem. Almost out of time.
so many different